Howdy, everyone. Let me ask you a question. Do you think a PT who has this long list of letters after their name is a better therapist overall than someone who just may have PT, DPT? So, do you think, and also, do you think patients care that that therapist that they're going to go see has his super long, list of letters afterwards? Let's talk about that. But first and foremost, let me introduce myself. I am Matt the PT, and I'm coming at you with another video on a topic that is something that we discuss and talk about in the physical therapy world. Next, I'd like to thank you so much for tuning into the channel. Thank you for the likes, comments, and subscriptions. Thank you so very, very much. And of course, if you like the video, hit that thumbs up button. If you would like to drop a comment about your beliefs, your experience, or anything like that, I feel it is very, very important to have this discussion and to talk about them. And maybe we can walk away with a different view and belief of it as well. And of course, subscribing to the channel so you can keep up to date on all of these videos. Now, getting into the certification. Now, I'll say that this kind of came about. I've heard this over the years that these certifications are great. You need to get all these certifications because it's going to help you in your career and you're going to get all these patients. But I've heard on the other side, it's just a waste of money. You're going through all this stuff and nobody really cares. Just be the best therapist that you can be. And really, what's the best thing to do? What is the best overall thing to do? And this came about because somebody hit me up a few days ago. They said, hey, we're doing a study. We want to get input from people who are fellows. And if you don't know, I am a fellow of the AOMPT. I went through that in 2020. I completed it in 2020. And they said, I just want to ask you some questions. So I answered the questions about my journey on it. And they said, yeah, we're doing this because we want to get together this information about why you went through it and be able to pass that on to others who are deciding about it. They're thinking about it. Should I do the fellowship? Should I not? Is it really worth it in it? And I said, that's very good. I think that is very important. But I want to talk about some of this stuff, that we really, really see with it. And also I'll kind of give you an idea on should you or should you not do some of these certifications. First thing I'd like to bring up about these certifications and I'd like to ask about and talk about is, do you think patients really care about them? Now, I have several on it. I am certified manual trigger point therapist, so I do dry needling. That's just the one through the institute I went through. I am a diplomat in MDT, so I do have a diploma in the mechanical diagnosis and therapy, or the McKenzie approach. Of course, the fellow of the AAOMPT. I am actually a certified clinical instructor, and I think that's all I got. So those are the ones that I have, and I've had positive and negative experiences with all of those. And I've seen that with other things as well. And I really ask this in people bring this, like patients don't care about them. And I will say, I do believe for most certifications that patients really don't care for some of them, that they really don't care. Now, every organization, like I said, that I've gone through, they point out people are going to look for you. We have our database and stuff. People, they're going to come find you. You're going to have these letters and you're going to show it. But in all honesty, I know in my case, I haven't gotten a lot from some of them and I've gotten more from other ones. Now I'll say in like my case, and I'm just going to use me. This can be different for everyone. And I do believe this is different for everyone based on where you are, your experience. I believe it's great that we're all different. And if you had a different experience, please share it, talk about it. I want to hear about it. But I would say like the dry needling. So my dry needling certification, I've had people search me out for that and people who have looked for it. So patients saying, hey, I want to find someone who dry needles. So they look up and they find, oh, you do dry needling. Likewise, the providers. So those physicians, I found for some of the certificate, they don't care. They don't care that you have them. However, there are the things like the dry needling. That's, oh yeah, so I think this would be good for somebody, and they may send over for the dry needling. Likewise, my McKenzie training, I get the vast majority of my patients that I see are sent from they look me up. They said, "Oh, you're McKinsey trained. You pop up when I search, or you saw a friend of mine, you saw my neighbor, you saw my mother, you saw my coworker, and I treat me too." So I get a lot from that. I get a lot of physicians that will look me up, and then when they know and they look for that, and they refer just because of that, because they say, "Hey, I know, I believe in this method, and how this person is going to treat," and they send. So I would say, whatever your beliefs on either one of those is, that's my experience on it. And I know this works for other things. Certified hand therapists, that they are specialists, or certified hand specialists, they get people that will send just to them. I've had them call clinics I've been in. "Hey, do y'all have a certified hand therapist there?" Say, "No, we don't." "Okay, well, we're looking for one." I know with Parkinson's, that Big and Loud certification that they've looked for, patients' families and physicians have called looking for those, or vestibular things, or pediatric. Now, I don't know as much about those areas with the certifications and things that you get, because I don't work in that area. But I know that there are some that they specifically look for, and they're going to get patients who have those things. Now, I will say there's other certifications, people or whatever, they don't know what it is. The docs don't know. My fellowship. As much effort and work that I put into that, I have maybe got one person who came to me just because I was fellowship trained. And that doesn't bother me. To me, it doesn't bother me. And I know that the Institute really talks about that, we got, people are going to come out and find you out. And there have been other therapists who said, yes, people look for me just based on that. I have, like I said, one. And no physician has referred over to me because of that. I've had it for almost 4 years now. Like I said, nobody cares about that. And I'm perfectly fine with that people don't recognize it, because it's not a big thing outside of what we do. And I think that goes for some of the other things that we have as well, that people don't, the OCS, the NCS, the SCS, CSCS, that's not really with us, but a kinesiology, kinesiology tape certification. Like, do they care about those things? Do they really honestly care that we have? And I do think that it's, maybe one or the other. Now, this is another area that kind of gets me with these certifications, and that I just want to talk about as well, that I think there's people out there that put out some of these certifications that, again, people don't really care about, and they're just money makers. And I'll say that. I'll straight say that some of these can just be money makers. And I now, I will say that's not a bad thing. It's not a bad thing, always. Because if there is an institute or something that is putting out, hey, this is a very reputable method or approach, we're going to streamline it. We're going to have educators who are very educated in it, really focusing on the technique and approach, and have this very high standard. I can see, yes, you do charge for that, because that is a lot of time and effort that you're putting forth into it. And I do believe that it is an investment, and it is important, because if it was free, people probably wouldn't value it very well. And by charging that money, you're able to reinvest back into the courses. You can pay your educators. You can have a better website. You can have a better, that website can be better for hosting and sharing knowledge. You can put it back into research as well, just to support your method, putting it back over there that, hey, we got this money from our courses. We're able to put forth that into research to help strengthen what we do. We also put it onto our website. So we have this library of videos and the research and discussion. We have all of that. But I will say, I have seen individuals come up with their own certifications. So there was one I saw not long ago that a student had, and I looked at it and I'm like, I cannot believe that this guy went through. I didn't say anything about it, but I know of the guy who did it, and I'm like, that approach or whatever he's did is, kind of questionable and iffy at best. And this really just looks like it was a big grift. Like, I don't think people are searching out for this certification. Like, it was really just something that got put out there. Now, I will say, I do know of reputable organizations and things like that that have had people who just utilize it to just make money. So I don't want to dive too much into that. But there are, otherwise people do those things to just make money about it. And I do think that is a big drawback as well for some of these certifications. And lastly, a thing I like to talk about is that if doing these certifications, do they actually make you a better therapist? And I've really kind of questioned some of those things as well with some of these certifications. Now, I know that there are some certifications out there that are just really just knowledge based, that if you're a good test taker, you can take courses and things on how to just take the tests for those. Is that really making you better? If it's like, okay, you just read these books, watch these videos, and you can just regurgitate knowledge on these tests, like, does that really make you a better therapist in the long term compared to ones that make you actually demonstrate the skill on it? And like I said, I have seen both. I have seen the ones that just go in there and you just regurgitate the information. If you're a very good test taker, you just get the certification. And I'm like, there's really no difference in your ability to treat whatsoever. Like, you're kind of treating the same. Like, your outcomes didn't improve. They didn't get better. If anything, they're kind of the same. But I've seen that likewise when people have went in and done things, a certification, that they learn a skill. They had to check off on the actual practical application of it. So you have to utilize this with people, tell the methodology behind it, your belief and what and how and who, and that you see with this therapist as they go along that they're a different therapist, that their outcomes do change because they are actually putting forth all of that knowledge in the things that they learned in that certification. So things I'll leave you with. What I really believe when going through, when you're looking at these things out there, because like I said, there's all this stuff for us out there as therapists, and we don't know, is it worth going through a certification or not? So I do have some things that I pass on to students or other therapists, and I'll share them with you. One, I'll tell somebody about any kind of continuing ed or anything like that to really look if you happen to have a gap somewhere. Are we having a group of patients that are come in and that we're not really well prepared, or the outcomes are not very, very good on it? So I will utilize the McKinsey stuff on it to say, hey, we're getting a lot of back pain patients that are coming in here, but maybe our outcomes with them are just not super great with it. And we said, hey, if we really go through this and we become certified in MDT, will this translate over to better outcomes with it? So maybe they improve it. And you're seeing, okay, hey, we're really, really getting that. But I would say, like, on the flip side, like, would it be worth getting the certified hand therapist, going through that if you actually don't get a lot of hands? Now, again, that could be something that's like, hey, we want to expand into that. To say, hey, we want to bring this in over to here to help our clinic because, maybe there is a demand and nobody in the area is really focusing on hands. And yes, that could be very beneficial. But if you're in an area and saying like, okay, well, we don't have a lot of hand patients, or we don't have a lot of this, or, that there's already other ones around here, is it really worth trying to bring that in and putting a lot of effort into this to get maybe just a marginal little bit of an outcome with it? Something to keep in mind. Keep in mind as well, it may not make you more money. That's something. So sometimes people will go for these certifications, hoping to go back to their employer to say, hey, I deserve more money. So you should increase my pay because I am a fellow. I have the OCS. I am a certain MDT, or I have or have any of that. honestly, employers don't value it very, very much either. They don't put a dollar amount on it. So some do. Now, I will say some will. And if your employer is one that say, hey, we'll give you an increase in your pay if you have these certifications, that could be something that you can really consider. But saying like, well, I'm going to do this to get more money, very often your employer may not. Now, I will add this in. It can make you more valuable to the next employer. That is one thing to keep in mind. If you can utilize, hey, I'm going through these certifications and I'm getting this, and you can use that in your negotiations with another employer to get a better pay raise. So to say, okay, well, you're not going to give me this pay raise, but I can utilize this to say, hey, you're going to have somebody who is certified in this and that, and I just believe that should be paid this amount. You could very well get that. Also, I'll say with your pay, if you happen to branch out on your own or you do those things, you can market yourself. Hey, I'm an expert. I am certified in this, and really marketing yourself as that expert, that person who really, really knows it, and getting people to come in. Also, I would talk to people who have the certifications. Now, this is something I do see quite a bit, that people throw their opinions about this and that around. And if you really look, they may say, oh, I've taken a course or two on that. You don't really need to get certified. I would say this. If you really just taken a course or two, do you know the information enough on it? Do you really know it well enough? Like, yeah, maybe you took a course or two, but that's, can you ask a high school senior or like, physics questions or science questions because they had a couple, could they answer that same thing as, someone who is a physicist or, works in anything, they just took a couple courses on it. Could they answer it at the same level as someone who works in it? So I would say reach out to people who have the certifications and talk to them about it. Like, what do you, and ask them just point blank questions. Don't add, I wouldn't just say with those little, just kind of BS ones and be like, oh, how much do you like it? Oh, I love it. Ask them, what's hard about it? Do you feel like you're lacking anywhere? Would you change anything about it? What are the pitfalls of it? I mean, ask those questions about the negative aspects of it. So, and they should be able to tell you about those negative things. And if everything's all hunky-dory, happy, I will tell anybody about the hard stuff that the drawbacks and stuff with what I do on it. I'm more than happy to talk to people about it and to tell people like, yes, really, this is beneficial or this isn't, or you can go this other route. I'll be very candid and open with you about it. It also can help getting away from those ones that are just like, that may be questionable. Like I said, to somebody who threw together 10 modules and say, you pay me $5,000 and you get my, certification that you throw on the wall and a specialty pen that you can show off. And it's like, really, is that going to really, really help you in the long run as well? So those are some things. But I will say this, and I'll leave you with this. If you go through that stuff, you talk to people and you say, yes, I'm really going to do this. You can walk away a change therapist. Really get into it. As somebody once told me, they said, if you're really going to study something and you're really going to do these certifications, become a purist for a period of time. Become a purist. Really get into it and spend a significant amount of time being a purist. So, hey, a year on it, 18 months, saying, hey, I'm really, really going to utilize this and really be very, very deep about it for a significant amount of time to really understand it. And I promise, I would say, I don't know if I promise you, but I will say you may really come out a much different therapist. I will say a lot of that has happened to me and has happened to others that I know that they really got into something. They walked away and they felt like, I feel like I'm a better therapist. I can ask better questions. I can empathize with my patients much better. I can get to the treatments. I am much, better when I do these things. And it's because of my training, and it can lead to other things as well. So with that being said, please, if you enjoyed the video, hit that thumbs up and of course subscribe to the channel. And I want to know your thoughts and your opinions and your belief. What is your experience in it? Do you believe certifications are beneficial? Do you believe some are better than others? What would you recommend to those people that are coming up? What would you tell them? Should you do this or should you not? Let me know your thoughts. Let me know your beliefs, your whatever that you've done. I want to hear about that. So, now, until next time, take care of yourself, take care of your patients, and I'll see you then.